Welcome to The Explainer. Look, if you're joining us today, chances are you've experienced the absolute exhausting frustration of watching a beloved pet constantly scratch, lick, and chew themselves. It just breaks your heart, right? It keeps you up at night, and you literally just want to find a way to make it stop. Well, today we're launching a full-scale medical investigation into this exact issue.
So let's dive right in. I want you to think of this endless scratch and itch cycle as a classic whodunit medical mystery. There's a culprit out there, causing your furry best friends some intense discomfort, and we're going to solve this case together.
Now, the fancy clinical term for all this scratching and chewing is pruritus. But looking at the research, there's a fundamental truth we really need to establish right up front. Pruritus is not a disease itself. Actually, scratch that. It's just a symptom. The itching is just the smoke, and we need to play detective to find the actual fire.
Here is our investigation board for today. We've got 1. The itch investigation begins. 2. Suspect 1. The flea. 3. Suspect 2. Environmental allergies. 4. Suspect 3. Food allergies. 5. The diagnosis protocol. And finally, 6. Treatment and long-term relief. Section 1. The itch investigation begins. Before we go naming our suspects, we kind of have to assess the crime scene, right? And the visible destruction on a pet's body can be really severe. We're talking about constant scratching, rubbing, and gnawing. You might notice hair loss, which veterinarians actually call barbering, just from all the licking and chewing. There's often intense redness, hot spots, and even secondary yeast or bacterial infections caused directly by the pet just traumatizing their own skin. And of course, this physical distress leads to obvious anxiety and whining. It's just a miserable state for an animal to be in. Section 2. Suspect 1. The flea.
Okay, it's time to introduce our first prime suspect, the cat flea. This villainous little invader attacks both dogs and cats, and honestly, it's by far the most common dermatological culprit. But the crucial takeaway here is this: it's rarely just the physical bite that causes the extreme reaction. It's actually flea allergy dermatitis, or FAD. This is a hypersensitivity disease caused by an allergic reaction to the antigens injected through the flea's saliva when it feeds. Yuck, right? In dogs, this saliva reaction causes intense itching and scabbing primarily on the lower back, tailhead, and thighs. In cats, you'll often see excoriation and hair loss focused around the head, neck, and back.
To defeat the flea, you really have to understand its MO. The life cycle goes from egg to larva to pupa and finally to adult. But the pupa stage, that's the real menace here. Flea larvae spin cocoons to become pupa, and they can hide out in your carpet fibers like tiny armored ticking time bombs for up to 6 to 8 months. They literally just wait there for a warm host to walk by before they finally emerge as adults. And prepare yourself, because here's a truly shocking biological fact. Once an adult female flea jumps on your pet, she begins feeding almost immediately. She can consume 15 times her body weight in blood every single day. 15 times. And while she's doing that, she's laying up to 40 to 50 eggs daily, which fall right off your pet and directly into your home environment. Section 3. Suspect 2. Environmental allergies. Now, if the flea isn't our culprit, we have to look at an internal betrayal of the immune system. Environmental allergies, which are known as atopic dermatitis, are triggered by things like pollen, molds, dust mites, and grass. What's fascinating here is how specific the target areas are. Unlike the flea, which loves the tail head of a dog, environmental allergens typically strike the face, paws, armpits, and lower belly. It's also highly associated with chronic, stinky ear infections. Owners can often track a seasonal pattern to these flare-ups, very much like human hay fever.
Section 4, Suspect 3, Food Allergies.
We're now interrogating our final major suspect, food allergies. While they only account for about 10% of pet allergies, they're an absolutely critical piece of the puzzle. When we look at these two internal suspects side by side, a pretty clear pattern emerges. While environmental allergies often have seasonal flares from inhaled or contact allergens, food allergies are typically a year-round problem. And get this, they're most frequently triggered by a protein source, like chicken or beef, not grains like so many people assume. The real crucial giveaway for a food allergy is that the itchy skin is often accompanied by gastrointestinal issues, like chronic gas or diarrhea.
Section 5, the diagnosis protocol. So now that we have our lineup of suspects, how do veterinary detectives systematically crack the case? Well, they use a strict step-by-step protocol to get a definitive diagnosis. Step 1 is ruling out parasites. They'll use a fine-tooth comb looking for fleas or flea dirt, which, by the way, is actually dried blood excreted by the flea. Gross, I know. Step 2 is using skin cytology to check for secondary yeast or bacterial infections that are just compounding that itch. If those are clear, they move to step 3, highly specialized intradermal skin testing or serologic blood testing for environmental allergies. And finally, step 4 is an elimination diet. You basically have to feed your pet a strict novel protein, like venison or rabbit, for 8 to 12 weeks. And that means absolutely no cheating with table scraps. It takes intense patience from both you and your begging dog. Section 6, Treatment and Long-Term Relief. When it finally comes to treatment, the pharmacological solutions are essentially a multi-pronged attack. Veterinarians target specific problems with very specific weapons. To kill fleas rapidly, they use oral or topical isoxazolines combined with insect growth regulators to stop the eggs from hatching. To stop the unbearable itch and suppress the immune system's painful overreaction, they might use glucocorticoids or a targeted medication like oclacitinib. And for those secondary bacterial or yeast infections, they'll deploy specific antibiotics and antifungal shampoos. But listen, medical treatment for the pet is only half the battle if fleas are the suspect. You absolutely have to neutralize the home environment's biomass. All those eggs, larvae, and pupae hiding in your house, you must treat all household pets. Aggressively wash bedding, vacuum deeply and frequently, and use premise treatments with insect growth regulators. This requires a serious marathon mindset from you, the owner, to truly break that life cycle. There's this one specific line in the MSD Veterinary Manual that perfectly captures why this is so difficult. And it says, the existing biomass residing within the premises means that complete elimination often takes up to 3 months. I mean, doesn't that just completely validate the struggle? Failure to solve a flea problem overnight is totally normal. It takes time, consistency, and lifelong prevention to truly clear the environment. Well, we've covered a lot of ground in this explainer today, haven't we? The evidence is all on the table. So I want to leave you with this provocative thought. As you look at your scratching pet right now, is your home harboring a hidden suspect? Deep in the carpets? Is it floating in the spring air? Or is the culprit already sitting right there in their food bowl? Take this knowledge, partner with your vet, and go bring your best friend the peace and relief they deserve. Thanks so much for joining me on The Explainer.